जो सिस्टम है, मस्कुलो स्केलेटल सिस्टम जो है उस सिस्टम तक पहुंचने के लिए हाउ दिस सिस्टम इज फॉर्म, मस्कुलो स्केलेटल सिस्टम, हाउ दिस सिस्टम इज फॉर्म। मस्कुलो स्केलेटल सिस्टम के अलावा बॉडी में और भी तमाम तरह के सिस्टम्स हैं। मस्कुलो स्केलेटल सिस्टम बेसिकली इट डील्स विद मसल एंड skeletal. It is the muscular and skeleton. मस्कुलर एंड स्केलेटन, मस्कुलर स्केलेटल जो सिस्टम है इसमें दो पार्ट हैं, मस्कुलर एंड स्केलेटन। आज हम जो बात करेंगे वो मस्कुलर की बात करेंगे, क्योंकि इस टॉपिक को हमने 2 लेक्चर में कवर करना है। मस्कुलर का जो टॉपिक है वो आज हमने कवर करना है, और स्केलेटल का जो टॉपिक है वो हमने जो है अगली क्लास में कवर करना है। सो मस्कुलो, जैसे मैंने आपको बताया कि मस्कुलो स्केलेटल सिस्टम है, ये बेसिकली मसल, बोन और सॉफ्ट टिश्यूज के बारे में हमें एक ओवरव्यू देता है। और इसके अलावा बॉडी में और भी तमाम तरह के टिश्यूज हैं, सिस्टम्स हैं जो हमारे शरीर में मस्कुलो स्केलेटल सिस्टम के अलावा सर्कुलेटरी सिस्टम है, कार्डियोवास्कुलर सिस्टम है, एंडोक्राइन सिस्टम है, डाइजेस्टिव सिस्टम है, रेस्पिरेटरी सिस्टम है, रिप्रोडक्टिव सिस्टम है, लिम्फेटिक सिस्टम है, इम्यून सिस्टम है, नर्वस सिस्टम है, तमाम तरह के और सिस्टम हैं, जिसमें कुछ सिस्टम्स आपको फिजियोलॉजी के लेक्चर्स में, फिजियोलॉजी का जो सब्जेक्ट है आपका स्पोर्ट्स साइंस का, उसमें आपको पढ़ाया जाएगा। लेकिन आज हम बात करेंगे मस्कुलो स्केलेटल सिस्टम में जो पहला पार्ट है मस्कुलर सिस्टम के बारे में। Now come to the point how this system is formed. How the system is formed. You see in this picture, at chemical level, atom combines and form molecules. In this picture, you see that atom combines and form molecules, and cells are made up of molecules. Atom combines to form molecules, and cells are made up of molecules. Similar type of cells form tissue. Similar type of cells form tissue, and different type of tissue form an organ, and different organ combine together and they form system. So this is the cycle that starts from the chemical level to, in an organized way, they form a system, means atom combine, form molecules, cells are made up of molecules, similar type of cells form tissue, and different type of tissue form an organ, and different organ combine together and they form system. So this is the cycle from where this system is formed. So this musculoskeletal system, see in this picture, this is an overview of musculoskeletal system. In this picture you see muscles, bone and soft tissue. They combine and they form an overview of musculoskeletal system. Muscle, bone and soft tissue combine and form a system that is called musculoskeletal system. Musculoskeletal system. So we have to come to know that what are the basic anatomical position. Basic anatomical position, because just to learn about musculoskeletal system, we have to we must aware of the basic anatomical position, anatomical planes, so that we can understand about the musculoskeletal system. So this is the anatomical position. Anatomical position. In this picture, you see an individual is standing upright. An individual is standing upright, looking forward, feet parallel and flat, arms are at the side, palm facing forward, and thumb is pointing away from the body. Thumb is pointing away from the body. So this is a basic anatomical position. Basic anatomical position, an individual stands upright, feet flat and parallel, looking forward, palm facing forward, and thumb pointing away from the body. Different away from the body. Thumb is pointing away from the body. So this is the anatomical position. There is a functional position also. In functional position is similar to anatomical position, but except this palm is facing sideways of the body. There is a basic difference in anatomical position and functional position. In anatomical position, palm facing forward and thumb pointing away from the body, but in functional position, palm facing sideways, except forward, palm facing sideways of the body. Now come to the anatomical planes of the body. There are three major anatomical planes. Just to understand about this musculoskeletal system, there are three major anatomical planes in the body. You see in the picture, when we divide the body in right and left, in two parts, right and left, it is a sagittal plane. It is a sagittal plane. Sagittal plane divides the body into right and left. Before coming to the sagittal plane, we must know about what is plane. Plane is an imaginary line that divides the body in a specific sections. Plane is an imaginary line that divides the body in a specific section. So there are three major planes in the body: sagittal plane, coronal plane, and transverse plane. So in sagittal plane that divides the body in two halves, right and left. Then come to the coronal plane. Sagittal plane को हम median plane भी बोलते हैं. Coronal plane, it is also known as a frontal plane that divides in the body in anterior and posterior. These are the terminology which is used in a technical term, in medical, in a medical term. So you must learn about this term. Coronal plane is also known as a frontal plane that divides the body anteriorly and posteriorly. Anterior means front, posterior means back. Posterior means back, anterior means front, and posterior means back, or you can say ventral and dorsal. Dorsal means back, ventral means belly side. So coronal planes divides the body in two parts, anterior and posterior. Anterior means front, posterior means back, or you can say, in other words, we can say ventral and dorsal. Ventral means belly side and dorsal means back side. The third one is transverse plane. Transverse plane divides the body into two halves, superior and inferior. That divides the body into sections, superior and inferior, or you can say upper or lower. Upper or lower. So, and basic anatomy of the musculoskeletal system, and these are the anatomical planes, anatomical position. Now come to this skeleton, you must aware of the bones. We must aware of the bones of the skeleton system, because in musculoskeletal we are talking in a basic anatomy of the MSK. We are not going in detail. You as a coach, you as a sports person, you must know about the bones and muscles superficially. You can point it out from outside that this is that bone, this is that muscle. So this skeletal system, you see at the top there is a skull. Below the skull there is a mandible. Then in cervical region, जिसको हम गर्दन वाला हिस्सा बोलते हैं, there are vertebra, cervical vertebra. Then chest area को हम thoracic area बोलते हैं, and there are thoracic vertebrae. Below thoracic there is a lumbar region, and in lumbar region there are lumbar vertebrae, and below lumbar sacrum, sacrum के नीचे pockets. So cervical, thoracic, lumbar, sacrum, and coccyx. This is the part of the vertebral column. Then come to the bone. This is the collarbone. The top is the clavicle. Then scapula, जिसको हम shoulder blade भी बोलते हैं. Then sternum, ribs, आर्म की जो ऊपर वाली बोन है उसको हम ह्यूमरस बोलते हैं. ह्यूमरस के नीचे दो बोन्स होती हैं, रेडियस एंड अल्ना. और रिस्ट ज्वाइंट के पास छोटी छोटी बोन्स होती हैं जिसको हम कार्पल बोन्स बोलते हैं. कार्पल्स बोन्स के नीचे मेटाकार्पल्स, एंड फाइनली एट द एंड phalanges in the hand. In legs you see thigh bones, that is called femur, and femur के नीचे there is a knee joint, and in knee joint there is a bone that is called patella. Then below knee joint there are two bones. Tibia is the inner bone, and fibula is lateral side bones, that is fibula. So tibia and fibula is the bones of the leg. Now come to the major muscles. You can see anteriorly, or you can see superficially. कोई भी खिलाड़ी यदि बिल्कुल सामने से खड़ा है तो बाहर से हम उसको कैसे पॉइंट कर सकते हैं कि ये कौन सी मसल्स है. सो इन दिस पिक्चर यू कैन identify what are the major muscles in the body from front, or you can say from anteriorly, or you can say a frontal view. Anteriorly you can see in shoulder there is a deltoid muscles. Then in neck area there is a sternocleidomastoid muscles. Then near neck there is a trapezius, and in chest area there are two major, pectoralis major and pectoralis minor muscles. Then in abdomen जो muscles है उसको हम rectus abdominis बोलते हैं. Then external oblique muscles, and inside the thigh there is a adductor, sartorius, and front of the thigh there is the rectus femoris. Or you all know about the quadriceps muscles. It is a group of four muscles: rectus femoris, vastus medialis, vastus lateralis, and vastus intermedialis. These are the four muscles who they form together a quad, and that is known as the quadriceps muscles. Then in leg anteriorly there is a tibialis anterior and posterior muscles. So these are the major muscle you can see from anteriorly or you, and these are the superficial muscles, and any sportsman can identify that this is the muscle, and you can tell about the problems that this is the problem in such muscles. So these are the major muscles of the front of the body, this is anteriorly, or you can say, and these are the superficial muscles. These are not the deep muscles inside the body, these are the superficial muscles. So we can see the posterior side of the body, that was from front, this is from the back. From back, there are so many muscles, supraspinatus muscles, infraspinatus muscle, then some external oblique muscles, semitendinosus, semimembranosus, gluteus maximus, hamstrings is a group of three muscles, hamstring, biceps femoris, semitendinosus, and semimembranosus. You all know hamstrings. These are the muscles of the back of the thigh. And there are some other major muscles, trapezius, deltoid, latissimus dorsi. You must know about the names of the muscles, who they are, superficial, and you can point it out from the outside. From front, you have seen different muscles. From the back, you can see these are the different muscles which are very, very useful in sports activity, and these are the muscles who they are susceptible in sports injuries. Now come to the joint. In joint, you all know what is joint. Joint is a point where one or more bones articulates or meets, they form joint. In this picture, you can see that there is a muscle, and the muscles का जो lower end है, that is called tendon. The lower end of the muscle is called tendon. And inside the joint, you might be seeing that there is a articular cartilage. Articular cartilage. That articular cartilage, it helps and prevents in the bone rubbing. इस आर्टिकुलर कार्टिलेज का जो मेन पर्पस है, ये बोन्स को आपस में रगड़ खाने से बचाता है. Then ligaments are surrounded around this joint. Then epiphyseal bones, these are the bones end where there is a bony growth takes place. Then bursa, you all know that bursa is a soft absorbing, that is a fluid filled sac, and this helps in jumping and landing activity. This is a soft absorbing material inside this body, and this helps like जैसे गाड़ियों में साकर का काम करता है, वैसे ही जो है in joints the bursa acts as a soft absorbing material. So bursa is a fluid filled sac, and that helps in preventing any damage to the joint. And then there is a joint capsule. Inside this joint capsule, there is a synovial fluid, and that synovial fluid helps in lubrication of the joints. That helps in lubrication of the joint. And at the end of this tendon or ligament, you are seeing that there is a structure called enthesis. At the end of the ligament and tendon. This enthesis is a basically connective tissue between tendon and bone, or between ligament and bone. Enthesis is a material, or you can say a connective tissue that connects from tendon, that is in between tendon and bone, or you can say ligament and bone, in between ligament and bone. This is called enthesis. Now come to the basic anatomy of the skeletal system. The aim is to provide a basic overview of muscle, bone and soft tissue. You all know that this musculoskeletal anatomy, it is a basic overview of muscle, bone and soft tissue. Soft tissue, you all know, except bone, all tissues are in category of soft tissues. The outer layer of the body, see this skin. Below skin, there is a fascia, and fascia is the covering layer of the muscle. Then there is a joints, bones, and muscles, ligaments, tendon, bursa. Joints is also known as orthosis. Various type depending upon the action of joint. Where two are, just I have told you that where two or more bones connect, and that is called an articulation. It's called joint. So ligaments connect bone to bone. Ligaments, they guard the joint from any outward or inward injuries, and these are the gatekeeper of the joint, and that they first defend from any impact outside or inside, and it allows range of motion and movement flexibility to the joint. Now come to the function of musculoskeletal system. The main function of musculoskeletal system, the skeleton, muscle, cartilage, tendon, ligaments, joints, and other connective tissue are all parts of the musculoskeletal system. Now this thing is clear to you all that musculoskeletal system, the skeleton, muscle, cartilage, tendon, ligaments, joints, and other connective tissue are all parts of the musculoskeletal system which work together to provide the body with support, protection and movement. मेरे कहने का मतलब ये कि मस्कुलोस्केलेटल सिस्टम आपस में एक शरीर को सपोर्ट करते हैं, प्रोटेक्ट करते हैं, मूवमेंट को प्रोटेक्ट करते हैं. They provide the body with support, protection and movement. Working all together, these skeleton, muscles, cartilage, tendon, ligament, joint, and all these connective tissue, they are the part of the musculoskeletal system जो एक दूसरे के साथ मिलके बॉडी को सपोर्ट देते हैं, प्रोटेक्ट करते हैं और मूवमेंट को allow करते हैं. So bones of the skeletal system protect the body internal organ. Bones of the skeletal system. स्केलेटन सिस्टम में जो बोन्स हैं उनका जो काम है वो शरीर के अंदर जो वाइटल ऑर्गन्स हैं उन ऑर्गन्स को प्रोटेक्ट करते हैं, सपोर्ट करते हैं एंड बॉडी वेट को भी जो है ये सपोर्ट करते हैं. सपोर्ट द बॉडी वेट ऑफ द बॉडी एंड सर्व द मेन स्टोरेज सिस्टम ऑफ कैल्शियम एंड फास्फोरस. Calcium and phosphorus is the storehouse where in the bones where this storage takes place in the bones. Calcium and phosphorus storage takes place in the bone, and this support the weight of the body and this protect the internal organ. मतलब जो हड्डी का काम है, बोन का काम है, स्केलेटल मसल, स्केलेटल सिस्टम में जो बोन्स हैं वो बॉडी के इंटरनल ऑर्गन को प्रोटेक्ट करती हैं, बॉडी वेट को सपोर्ट करती हैं और there is a storage of calcium and phosphorus in the bone. The muscle of the muscular system keep the bone in place. They assist with movement by contracting and pulling on the bone. जो मस्कुलर सिस्टम है, मस्कुलर सिस्टम में जो मसल्स का काम है वो बोन को एक पोजीशन में रखती हैं, एक प्रॉपर प्लेस में रखती हैं एंड दे हेल्प इन असिस्ट द मूवमेंट को भी असिस्ट करती हैं और दे कीप द बोन इन प्लेस. Now come to the movement, how this movement takes place. Movement, कोई भी movement हम करते हैं, कोई भी exercise करते हैं, there is a movement. Movement is because of muscle contraction and stretching. मसल जब कॉन्ट्रैक्ट करता है और मसल स्ट्रेच होता है, देन देयर इज ए मूवमेंट. सो मूवमेंट बेसिकली यदि देखा जाए तो दो तरह का मूवमेंट होता है, एक्टिव मूवमेंट और पैसिव मूवमेंट. एक्टिव मूवमेंट कई तरह के होते हैं. फ्री एक्टिव मूवमेंट होता है, असिस्टेड एक्टिव मूवमेंट होता है, असिस्टेड रेजिस्टेड एक्टिव मूवमेंट होता है, एंड देन रेजिस्टेड मूवमेंट होता है. रेजिस्टेड एक्टिव मूवमेंट होता है. बेसिकली रेजिस्टेड एक्टिव मूवमेंट जो हम वेट ट्रेनिंग एक्सरसाइज करते हैं जस्ट टू इंक्रीज द स्ट्रेंथ ट्रेनिंग जिसको हम बोलते हैं, वो अगेंस्ट रेजिस्टेंस करते हैं. दिस इज परफॉर्म विद रेजिस्टेड active movement. So this resisted active movement is for strength building. So there are 4 types of active movements: free, assisted, resisted and resisted. Then come to the passive movement. Active movement का मतलब होता है कि खिलाड़ी अपने आप कोई भी मूवमेंट करता है. पैसिव मूवमेंट में he can't move the part that needs some support, outside support. किसी की हेल्प की जरूरत होती है, जैसे कभी कोई किसी तरह की ऐसी इंजरी होती है जिसमें there is a muscular weakness, so that needs some assistance outside, or you can say the help of some other person. That is called passive, and this passive exercises is also a part of the movement. So passive movement एक रिलैक्स पैसिव मूवमेंट होता है, दूसरा होता है पैसिव मैनुअल मोबिलाइजेशन, या एक तो होता है फ्री जिसको हम आउटसाइड किसी भी जो है पर कोई भी बाहरी आदमी जो है मूवमेंट को कराता है पैसिवली, किसी की सहायता से जब हम कोई मूवमेंट करते हैं, दैट इज कॉल्ड रिलैक्स पैसिव मूवमेंट, और यू कैन से. बट समटाइम्स देयर इज अ जॉइंट स्टिफनेस, देयर इज a the mobility of the joint is affected, so sometimes there is a passive mobilization also that is performed, that is passive manual mobilization, that is called passive manual. So these are the movements, active and passive. And muscular contraction and stretching, that brings the joint movement. So muscular contraction, there is a question, muscular contraction होता कितनी तरह का है? Muscular contraction 3 तरह का होता है. Muscular contraction is of 3 types: isometric, isotonic and isokinetic. Isometric, isotonic and isokinetic. Isometric में क्या होता है कि जो स्पीड होती है that is fixed. In isometric exercises, speed is fixed. Resistance, there is no resistance, and there is no joint movement. जो हम आइसोमेट्रिक एक्सरसाइजेस हैं, जो आइसोमेट्रिक एक्सरसाइज करते हैं, उस आइसोमेट्रिक एक्सरसाइज में देयर इज ए फिक्स स्पीड, देयर इज नो रेजिस्टेंस एंड देयर इज नो जॉइंट मूवमेंट. इन isotonic contraction, in isotonic contraction there is a variable resistance. Isotonic contraction, there is a variable resistance, and in isotonic contraction there is a variable speed, not resistance. There is a variable speed and resistance is fixed, and there is a joint movement. In isotonic contraction, there is a variable resistance and variable speed, and resistance is fixed, and there is no joint movement. And in isokinetic contraction, there is a fixed speed, there is a variable resistance, and there is a joint movement. This is the difference of all these: isometric, isotonic, isokinetic. In isometric, speed is fixed, no resistance, no joint movement. In isotonic, there is a variable speed, there is a fixed resistance, and there is a joint movement. And in isokinetic, there is a fixed speed, there is a variable resistance, and there is a joint movement. So this is the muscular contraction. So that allow motion different bones are connected by joints, which are connected to other bones, muscle fiber, via connective tissue, like tendons and ligaments. So the main purpose of cartilage, that prevents the bone ends from rubbing directly on each other. Cartilage prevents bone ends from rubbing directly on each other. कार्टिलेज का जो काम होता है वो दोनों बोन एंड्स जहां पे ज्वाइंट बनता है उसको आपस में रगड़ खाने से बचाता है. Malnutrition and arthritis are the example of disorders and diseases in the body that can severely impair the function of musculoskeletal system. Malnutrition, proper nutrition and arthritis are examples of disorders and diseases in the body that can severely impair the function of the muscular system. Sorry, there was a network disturbance. Now come to the skin. You can see in this picture, the outer layer is known as epidermis, then dermis, and there is hypodermis, and in hypodermis you are seeing the blood vessels and sweat glands, hair follicle. So outside of the body, the outer layer of the body is a skin, and this skin is having three layers: epidermis, dermis, and hypodermis. Then come to the muscles. Muscles, I have already told you that the fascia is the covering layer of the muscle that covers the muscle, and inside the muscle there are muscle fibers and blood vessels. You can see in this picture, the outer layer of muscle is known as fascia, and that fascia covers the muscle. Inside the muscle there are muscle fiber, and in muscle fibers you are seeing these blood vessels also. There are three types of muscles: cardiac muscle, skeletal muscles, and smooth muscle. In sports, the maximum injuries takes place of skeletal muscles. In sports team activity, the maximum injury takes place of skeletal muscle. Skeletal muscles are prone to injury and during sports activity. So cardiac muscles, skeletal muscle, there are three types of muscles, but in sports, skeletal muscles are very, very prone to injury. You see this, the lower end of the muscle, which is attached to the bone, is called tendon. इन चीजों के बारे में आपको जानना जरूरी है. स्किन के नीचे फेशिया इज द कवरिंग लेयर ऑफ द मसल, एंड मसल का जो लोअर एंड जो बोन के साथ अटैच होता है उसको हम टेंडन बोलते हैं. मसल का जो लोअर एंड है जो बोन के साथ अटैच होता है उसको हम टेंडन बोलते हैं. In sports, the tendon injuries are very common. Sports like basketball, badminton, volleyball, where there is a frequent jumping and landing activities. So there is a tendon that is the longest and strongest tendon in the body. Achilles tendon. There is a very, very common injury take place, tendinitis. Now see the bones. There are different type of bones in the body: short bone, long bones, flat bones, irregular bones. Flat bones you can see in hip bone, flat bones, short bones, long bones, femur you can say. Sesamoid bone, the example of the sesamoid bone is patella, and irregular bones. You can see in our spine, vertebral column. This is a vertebra, is a irregular bone. This is a bone type: short, long, flat, sesamoid, irregular bones. These are the common types of the bones. In this picture, you see. Then, if you see this joint, this is a knee joint. There is a patella, there is the articular surface, the tibia bone, and there is a articular cartilage that helps in preventing the bone rubbing. Articular cartilage that prevents bone rubbing. Femur is the longest and strongest bone in the body. See the ligament of the joints. This is a knee joint. You can see there are different type of ligaments in and around the joint. Who they guard the joint during physical activity? They first defend. So ligament, you can say they are the gatekeeper of the joint. Ligaments, in a simple way, you can say they are the gatekeeper of the joint. They first defend from any outward injuries, any violent activity or any untoward activity. So ligaments, in a simple way, we can see they are the gatekeeper of the joint. In knee joint, there are medial collateral ligament, medial side, lateral collateral ligament, anterior cruciate ligament, and posterior cruciate ligament. These are the common ligaments who they guard knee joints, and once they injured, so they need proper recovery, they need proper treatment to recover from. That depends upon the degree of injuries, and sometimes when they are a severe injury or a grade 3 injury, or you can say severe injury, sometimes there is a requirement of the surgical procedure also. So after surgical procedures, there is a process of rehabilitation, and that rehabilitation that takes a long duration to recover athletes from the injury. Here you can see bursa. These are the shock absorbing material, and it helps during jumping and landing activity. It acts as a shocker in the body called bursa, and due to frequent jumping, landing, there is a repetitive stress over the joints, and that prevents any further damage. So this bursitis in athlete, especially this walking event, the hip, there is a trochanteric, but in hip joint there is a trochanteric bursitis is very common in athletics, especially in the walkers. Trochanteric bursitis is very common in athlete, especially the walking event, that is called trochanteric bursitis, hip bursitis. Cartilage, it is a avascular structure. There is no blood supply in the cartilage, and that helps. You all earlier I told you that helps in bone rubbing. It is a avascular structure. There is no blood supply. It's found mainly in the chest joints, certain rigid tubes, larynx, trachea, nose, ears to of the cartilage is that which is found at the end of the bone to provide smooth form of cartilage is that which is found at the end of the smooth surface for the movement. Cartilage that provides smooth surface of the movements, joint movement के लिए एक smooth surface provide करता है, and this is a avascular structure. The disc between vertebra and it is also, and between pelvic bone is the form of are the external structure of ears and nose. So these are the different areas where you can see the cartilage that helps in preventing the smooth movements. Now, this muscular system is a component of skeletal muscle and associated connective tissue, or you can say tendon. In this picture, you are seeing that what is the function of the muscular system. Muscular system that provides locomotion, that provides movement, manipulation of the environment, facial expression, maintain posture and produce heat. During physical activity, there is a production of the heat in the body. So this muscular system is a component of skeletal muscle and connective tissue called tendon, associated connective. As you all know that the lower end of the muscle where that insert in the bone is called tendon, and these are the component of the muscular system. इसका जो main काम है वो है locomotion, movement, then facial expression, you can say communication. These are the muscular activity that take place during any kind of contraction. Then it maintains posture. Muscular system that maintain postures and produce heat. Muscles are extremely elastic, very vascular, and having unique ability to contract and stress to provide movement. जैसे मैंने पहले बताया कि जब कोई भी मसल कॉन्ट्रैक्ट करती है और स्ट्रेच करती है तो there is a movement that provides a movement, and muscles are extremely elastic. इसमें जो फैलने और सिकुड़ने की जो प्रॉपर्टी होती है, इलास्टिक प्रॉपर्टी, स्ट्रेचिंग कैपेसिटी, एंड इट इज अ वेरी वैस्कुलर. इसमें ब्लड की सप्लाई बहुत ही ज्यादा होती है. सो दीज आर द एक्सट्रीमली इलास्टिक, very vascular and unique ability to contract and stretch, and that provides the movement. There are three types of muscle. I have earlier told you: smooth, cardiac, and skeletal muscle. The muscular system comprises of skeletal muscles, fascia, tendon, card-like structure that attach muscle to the outer layer of the bone called periosteum. जैसा मैंने पहले बताया कि जो मसल का लोअर एंड वो टेंडन होता है, एंड टेंडन इज ए कार्ड लाइक स्ट्रक्चर जो बोन की आउटर लेयर के साथ अटैच होता है. बर्सा के बारे में मैंने पहले भी आप बताया, इसे स्मॉल सैक फिल्ड विद साइनोवियल फ्लूइड एंड दैट रिड्यूसेस फ्रिक्शन बिटवीन द एरियाज बिटवीन द जॉइंट. सो बर्सा इज ए शॉक absorbing material, you can say. It's a shock absorbing component of the musculoskeletal system, and that is a filled with synovial fluid that reduces the friction in the area. Function of the muscle. What are the different function of the muscle? Muscle का जो पहला काम होता है वो है motion. Body moving its parts, and locomotion, body moving as a whole. जो पहला काम है मसल का मोशन. दूसरा काम है मोबिलिटी. When the smooth muscle of internal organ produce movement. Mobility, when the smooth muscles of internal organ produce movement. Heat production assisting metabolism and hemostasis. हीट प्रोडक्शन मेटाबॉलिज्म को असिस्ट करना और हीमोस्टेसिस को असिस्ट करना. देन मेंटेनिंग पोस्चर एंड जॉइंट मोबिलिटी. The main work of the muscles is maintaining the posture and joint mobility, and there are approximately 640 skeletal muscles in your human body. At least approximately, it's not exactly, but there are approximately 640 skeletal muscles in our human body. So, this is all about the muscular system. This muscular system that helps in motion, mobility, heat production, and posture and joint mobility. So, in a nutshell, I will just to recall the points which we covered today. कि musculoskeletal system क्या होता है? Musculoskeletal system is an overview of the muscle, bone, and soft tissues. You all know that except bone, all tissues are in the category of soft tissue, जिसमें आपकी skin है, fascia है, muscles है, tendon है, ligament है, bursa है, तमाम cartilage. These are all they all are the part of the soft tissue. Then what are the different anatomical position? Because in musculoskeletal system, anatomical position, planes are very important to understand. So in anatomical position, there is you all know that if any individual stands upright and looking forward, foot flat and this up parallel, then palm facing sideways, palm facing forward, arm at the side and thumb pointing away from the body, outside the body. That is the anatomical position, and this functional position, except palm facing at the side. There is a basic difference in anatomical position and functional position. Then in anatomical positions, you will see that there are some major positions like anatomical planes. There are three major planes: sagittal planes, coronal planes, and transverse plane. Sagittal planes, you all know that divides the body into right and left. Coronal plane that divides the body interior, posterior. Then transverse plane that divides the body in upper and lower, or you can say superior and inferior. So different type of movements, active movements and passive movements. Then there are three types of muscular contractions: isometric contractions, isotonic contractions, and isokinetic contractions. Isometric contraction means the speed is fixed, there is no resistance, and there is no joint movement. And in isotonic contraction, there is a variable speed, there is a fixed resistance, and there is a joint movement. And in isokinetic contraction, there is a fixed speed. Isotonic, there is a variable speed and there is a fixed resistance and there is a joint movement. And in isokinetic, there is a fixed speed and there is a variable resistance and there is a joint movement. This is the basic difference of all three muscular contractions, which is in the muscles takes place: isometric, isotonic, and isokinetic contractions. So this is all for today, and I would like to tell you that in our doubt and discussion classes, you people must ask about whatever the topic covered in theory. Related to the topic, there should be a discussion, not outside of the topic, because it is useless. We have to cover all the syllabus